Okay, it's 11 o'clock. Let's get started. Thank you again for taking time out of your busy schedules to join us for this webinar. Today we're going to spotlight the Manhattan Life Home Health Care Select product. Just a housekeeping note, just to maybe jot this down. On January 4th, we're going to have a State of the Industry webinar. Tom Randall is going to share with us kind of a year in review, and then also uh, talk about where we're going in 2024. It's going to be at 2 p.m. Central, 3 p.m. Eastern on January 4th, and look for an invite for that coming soon. So let's go ahead and just get into this topic. This is a really exciting product. We're very excited. Many of you have been doing business with us with Manhattan Life and perhaps running the Omniflex. And today we're going to talk about the Manhattan Life Home Health Care Select product. So here's the revealing. Here it is. The curtain has parted, uh, and we're going to get into this. And it's the great thing about this product is it's so easy to learn. It's even easier to present. So with that being said, let me give you a little bit of the background. Manhattan Life is one of the country's oldest insurance companies. They've been in business for over 170 years. They really specialize in the ancillary space. I want you to take this in as far as what I'm going to say, because it really it boggled my mind when I first heard this from the president of the company, and that is that this year in 2023, Manhattan Life will process over 225,000 applications. Now, they're not all home care and they're not all Omniflex, but they are with their whole menu of products that they have. So it tells you how reliable this company is and being one of the oldest, and also just how strong they are in so many areas on the product side. So let's get into a few little things that you could that will set the stage here. It's amazing. One of the reasons why this product is come on so strong is because of this statistic. 40% of those aged 66 to 69 and a staggering 47% of those over 70 are declining for traditional long-term care. I say this all the time on our webinars that we're in the problem-solving business. In the day that we can't solve a consumer's problem as agents, that consumer is going to turn to someone else. And so this is one of those products that is really helps you when underwriting becomes problematic. 3 of 5 personal bankruptcies in the United States are a direct result of overwhelming medical expenses. And guess what? 78% of those people had traditional health insurance. I don't remember the exact stat. It's somewhere around 16,000 or 18,000 of debt that caused people to go into bankruptcy. So you can imagine that if 16 or 18,000 created these 3 out of 5 bankruptcies, what would a home care ongoing cost lend itself as it relates to the bankruptcies? You know, it's a pretty scary statistic. So let's talk a little bit about the cost of care. People want to stay home. They want to age in place, and you can see here a map of the country of where some of the costs are a little bit more affordable, under $25 an hour. You can see in the medium blue where it's $26 to $29 an hour. And then you start looking at some of the Northwest and Northeast, and you can begin to see why these care costs are such a concern to a consumer that may find themselves needing care. And the reality is it's not brick and mortar cost that's driving these care costs up. It's the labor cost today and finding that quality of caregivers that are available to perform those services that family members don't want to have to perform if they could actually make sure that that people would, their family members would actually prepare and plan ahead. So let's get into the actual highlights of the product itself. So we're talking about an issue age of 45 to 89. We worked with Manhattan very closely on this, and we wanted to make sure that the issue age resembled what we have with the Omniflex, which is also that short-term care, extended care product. All of these fall into the extended care world, if you will. And 45 to 89 is great because, you know, people at all ages tend to have health issues that may prevent them from getting other solutions. And yet that upper age market is a market that is underserved and very much where in many cases the seniors have either been priced out of or underwritten out of other solutions. So the product's also guaranteed renewable for life. Comes with a 30-day free look. Simple underwriting. And we're going to talk about what I think is some of the secret sauce to this product, which is the prescription drug reimbursement program. 3 plans to choose from, very affordable premiums. We'll talk a little bit about that as we go forward. So this is indemnity based, and there's 3 plans to choose from. There's Classic, Premier, or there's Deluxe. And these services that you see here are the indemnity services that people can get cash out of that plan for those services. Up to that maximum. So you could have multiple services in a given day, but if you exceed the maximum, then that would be out of pocket for yourself. So anything within the 150, 300, or 450 is covered by the policy. And so these are pretty standard. There's other carriers out there that also have the standalone home health care. Some of you may be familiar with. We write some of those other carriers, and they all seem to look very much the same as far as what types of conditions they're going to cover. So just know that it doesn't really matter if Medicare pays. There's no coordination of benefits. So even if Medicare pays, this policy is going to pay as well. And again, it's full indemnity. I want to draw your attention to something I think it may seem like a small point, but it's something at least it's worth considering. Some of the other plans that are out there will pay a maximum benefit period of 360 days. Manhattan will actually go to 365 days. And this, again, matches up against Manhattan's other plan that we write a lot of, that some of you on this webinar have been involved in as well, and that's the OmniFlex. So the 365 days seems like a small difference, but yet it can add up. All right. Let's talk a little bit about that home health aid. You know, people do want to stay home, and this is with Manhattan, this is a separate benefit, not tied into the 150 or 300 or 450 on those 3 plan design selections. So you can get $40 a day for 60 days if you have a home health aid. And remember, one of the things when we worked with Manhattan is we wanted to stress not just for the home health care aid that is normally with a registered home health care agency, but also this would apply to using this with other folks that are in that same space, like a Visiting Angels or a Comfort Keeper. So the Premier has $80 a day and the Deluxe has $120. So if we do some simple math, you know, 40 times 60 is an additional $2,400 that they would get for that 60-day use of a home health aid. If they selected Premier at 80, that's 80 times 60 or 4,800. And if they use the Deluxe plan, which I will tell you personally, I think you're going to find Premier and Deluxe are going to probably be the ones that you're going to go to because you can get a little bit more bang for the buck. And $120 a day times 60 is an additional $7,200 that you can get for a home health aid for those for 60 days. Manhattan does cap that at 60 days, just so you're aware. Now, here's what I was talking a little earlier about the secret sauce. You know, we know that seniors today, and the average 65-year-old is using either on initial prescription or on refills about a little over 27 prescriptions. So it's not uncommon to think that someone who is doing generics at $10 or $25 at brand names would incur a fair amount in terms of what they're actually paying for those prescription drugs. And that's, you know, whatever they're, if they're on Medicare, then obviously, and they have a Part D, that you understand that the, you know, Part D is covering that. But here with the Classic, they can get reimbursed up to $300 yearly. And here's the thing you need to be aware of. They don't need to be on claim to utilize the prescription drug benefit. On the Premier and the Deluxe, they're capped at $600. Now that may seem like a lot, but there's a lot of people using lots of prescriptions, and in many cases, what I call this prescription drug benefit, when I'm talking to a consumer and when I've done this in consumer workshops, I call it the premium justifier. The client is looking for ways to mitigate that premium and to justify why they should take out this plan. And this prescription drug benefit can do just that for them. In many cases, it could mitigate some, if not all, those initial premiums, or at least reduce it down to where it gives that consumer, some significant relief when it comes to their out-of-pocket cost to take on this home health care select policy. So there is restoration, and restoration is very similar to how restoration works with some of the other plans today, that if someone has not been receiving services, it's the maximum period, let me just read it to you. The maximum benefit period for home health care select and aid will be restored if benefits have not been paid or required for 180 consecutive days. So if you actually spent money out of the plan and used the services, now we're not talking about the prescription drug benefit, we're talking about the actual services in the plan, and they went 180 days, it would restore, 180 consecutive days, you'd get full restoration at that time. Now, I'm not a big fan of riders when it comes to these type of plans, but I want to walk you through and just at least share with you what the riders are, and just so you're aware of it. Now, again, I'm not trying to share with you that you won't use these riders, but you have to be careful when you start loading up additional add-ons. There's also additional add-on cost, but there are some riders that may make sense. Now, in the Medicare space, you might say, well, I already get a free physical. And some of these are nominally priced. They're not expensive in terms of the out-of-pocket. But you could just know that if you wanted to add on a routine physical and get $150 sent back to the client, if they took on that particular rider, they could get that yearly. And again, that's an add-on. Accidental death and dismemberment benefits. Again, some of this may be when you're having conversations with a client and maybe they've had a history of someone in their family that's lost a hand or an arm, a farming accident, or some someone who's we knew a fellow back in the day, he was a very active woodworker, and I have to tell you, he lost more than just one finger through his woodworking experience. So I'm not saying that this rider doesn't make sense. There's certainly people that do have accidents where they could be able to get money out of their policy, and this is an example of that in terms of the benefit that's available. And again, pretty nominally priced as far as an additional rider, and you'll be able to see that when you go into the Manhattan portal and actually decide to get a quote. Home medical equipment benefit rider, benefits paid when you need home medical equipment prescribed by your physician. Again, these are ways to make the home safer. Maybe there's mobility assistance, transfer aids, home accommodations. Again, it's a lifetime maximum of $500. Not a lot of money, but again, it may be something where someone says, "Hey, I'm going to stay in my home, and I want to make sure I can have some additional medical equipment to make my home safer." Now, I do like the ambulance benefit. I think for just a few bucks a month, this is actually something that people do tend to use a lot. We see this an awful lot in the area of hospital indemnity products where they'll add on the ambulance rider. So that one is, I would put that more at the top of my personal list myself. But again, you have to decide where is the elasticity as far as from an affordability, and you don't want the riders to distract from what the overall goal is, which is to provide the home health care basic coverage. So Manhattan's done a really nice job with this new Home Healthcare Select of expanding their menu of riders. It's again where you can pick and choose, and just be careful that you're not loading this up and distracting from what the overall goal is. The other one is the accident expense benefit rider. This is again, dislocation, fractures, knee ligament tears. And so you've got two options here to get, again, money out of the policy for various conditions. The fracture, hip or skull, dislocation of the hip, tear of the knee, just dislocation of the knee. And we know that, and I'm not trying to discount the experience here. We know that falls are that create fractures are one of the leading ultimate causes of death for seniors. So once again, this is another rider. It's something that you can take a look at and determine whether or not you want to add it and put it in the cart for your client. So what makes this home healthcare select stand out and separate itself from others in the marketplace? Well, first, as I indicated, that lower issue age is really been very, very important, because some of the other plans have a higher issue age, and so therefore, opening up the net a little bit wider for those younger people who have got where health proves to be problematic for getting other plans, as we indicate. By the way, those declination numbers I talked about earlier they spike at those upper ages, but even at those younger ages, it's becoming more and more difficult to get people some of the other traditional solutions or some of the other hybrid or asset-based solutions as well. And so now they've also combined their skilled nursing and the general nursing are now combined into one nursing home benefit. And again, the home health aid is now immediately available to insureds and no longer requires. They had previously, in an older version of this policy, requiring a 3-day hospital stay, and we made sure that that was one of the sticking points for us moving forward to get to really want to promote the Manhattan, was to take away that 3-day hospital stay. And again, we just talked about all those additional riders that Manhattan is just trying to give more choices to the consumer. Now let's talk a little bit about state availability here. Approximately, I think if I did my math correct, that in the dark blue, there is where the Manhattan Home Healthcare Select is approved. Pennsylvania just came on actually as of, I think it was yesterday, and we've updated the map to reflect that. Lynn did a really nice job in our office of keeping us current. Her and Corey do a fabulous job of staying up on these state availability maps, because they're always changing. Now, we hope we're going to see in the near future Colorado, Kansas, Illinois, Indiana, and Kentucky, and Maryland that will come aboard as well. But right now we're at 31 states. And remember, with the home health care products, as well as the short-term care, such as the OmniFlex, we're going to get into the mid-30s, and that's about as far as we can go. We're not going to have coverage in those other states where you can see there in the gray: California, New York, Maine, Florida, Washington, Oregon, Minnesota, where GoldenCare is located. All tend to be very problematic. And Utah's a little bit tougher. Some of them have conditions that the carrier has to change kind of the configuration of their plan to be able to meet. So keep in mind, we do have it as part of our perfect portfolio, a 50-state solution. Reach out to one of the marketers at GoldenCare if you are in one of those states where the home healthcare Select or any of our other alternative insurance-based products are not available, and they can talk to you about a home care solution that may work for you in those states in the gray. Now the application, and I'm going to come back to the rates in just a second, but you can see here, and it's a little bit small print, but I'll read it to you because it's only 2 questions. And the questions are you currently living in a nursing home or assisted living, or currently receiving home health care type benefits? And if you answer yes to that, and if you answered yes to the fact that you're unable to perform your activities of daily living, that would prevent you from getting coverage. Generally speaking, we have about a 98% placement with this particular product because it's just that easy. There's just those 2 questions, and answering no to those questions are going to get you a pretty much of a jet issue. I'm not saying it's an immediate jet issue, but it's typically 24 to 48 hours that they're turning around these home health care select plans, because there's no additional underwriting. They're not doing a pharmacy check. There's no other, no phone interview, no MIB. So all of those advantages make this a very streamlined process. And remember, you didn't see on that 2 questions a third question that you sometimes see in some of the other carriers, and that is a cognitive question. So Manhattan has done a really nice job of trying to throw the net as wide as possible to make this acceptance, so that you can have the opportunity to help more people. Let me just pause for a quick second here. And as we've talked about everything to this point, I want to make sure within the application, I come back and just spend a minute here just to talk about rates. I don't have a rate sheet that's actually part of this PowerPoint, but I happen to have the rates in front of me, and I want to also draw your attention. When I turn back over to Lynn, she might be able to put this up or just remind everyone when we do a follow-up. But we do have a dedicated site that it's a resource site that houses both the OmniFlex and the Manhattan product, where you can get everything about the product, including the rates and the application, a sample of a sample policy, just everything that would be important to you to move forward with being able to quote and add this Manhattan product to your portfolio. And that is goldencareagent.com/omniflex-assets. And there you'll have everything there. So let me just give you a quick example. Look at that. Boy.
Dennis, I just snuck in there and showed that screen.
Lynn is, I'm always, I shouldn't be surprised, because she always does things that always amaze me about her tech skills. And so if you go down there to the rate, Lynn, pull up the rates, since you're now have taken control from me. Let's pull up and scroll down and let's just talk a little bit about the rates here for everyone. And again, they are, you got to look at the states, because they are bunched in and so here you can see Alaska, Alabama. This is kind of a grouping of the rates. But look how affordable this is. Oh my gosh, let's just take a 65-year-old that you're working with that's a Medicare client of yours, and that classic plan is $25.88 a month. The premier is $40.41 a month, and the deluxe is $43.03. Now remember, there is a $20 annual policy fee with the Manhattan Home Health Care Select, and it is attained ages, by the way. But look at that prescription drug reimbursement that we talked about earlier, and just imagine that 65-year-old client that takes out a classic plan at $25.88. In essence, you've mitigated in their premiums as long as they're in that 65 to 69 age band. And these rates do ramp up. So remember, part of that full disclosure to the client is you've got to make sure that you share with them, because clients have memories of convenience. They forget things, and they're going to forget. They're going to think that rate that they started with, which if they had an OmniFlex, the rate they started with is the rate that they would stay with. But with the home health care select plans, they are ramped up in 5-year age bands. And so again, the affordability is just amazing. And if you went to that premier example with $40.41 a month, so we're talking a little under $500 a year. Remember that prescription drug reimbursement goes all the way up to $600 a year. So that's why I call it the premium justifier, because it justifies why they're going to take out this plan, knowing that they don't have to be on claim, and every year they can file that claim form and get that reimbursement. So Lynn, thank you very much for pulling up that site and making sure that we have it. And
you're welcome.
If you went back, I was going to just tell you, if you were still back on that site, if you could just show, we could just show the rest of just what else is there. Not that we'll pull that up, but just so that they can see the other tools, both for the OmniFlex and for the Home Healthcare Select. So you can see here, we just pulled up the rate guide, but there's also the sample application, sample policy, there's the agent flyer, there's an infographic that we actually worked with Manhattan to create. You can see the state availability there. And again, all of that is on one site to make it easy for you. And of course, the EAP process with this, although this is not an EAP discussion today, but if you go to the same Manhattan platform that you've used, if you're writing OmniFlex, you'll see the Home Healthcare Select plan. And literally, with those two questions, and the fact that you probably already have a lot of your clients' basic information because they're an existing client, I'm talking less than 5 minutes as far as being able to enroll someone within that. And remember, these plans, and thank you, Lynn, for doing that, for just showing that again, that site. These plans, keep in mind, either can function as a standalone solution, they could function in concert with that OmniFlex, where maybe your client could only get a tier 1 with OmniFlex, and so they only get $100 a day maximum benefit. So you want to come back in and backfill, and maybe you've been on some of our previous webinars where we talked about stacking or bundling these particular plans, where you have the opportunity to in essence, add the additional coverage. Keep in mind also that you might have someone who bought long-term care. Maybe they bought an older long-term care plan, and there's some out there that had not 100% for home health care, only had 50% for home health care. And now again, they've gotten to an age where it's problematic for them to consider adding to a traditional long-term care or an asset-based solution. And so you're looking and saying, hey, why don't we just add a little additional home care? And again, that prescription drug reimbursement benefit is going to help you tremendously to mitigate that premium and get that client to consider this coverage. This is a great, great solution to have. We want you to know that, everything about that application is so darn simple. This isn't long-term care, folks. This is not a 55-page application. Look at that right there. That's how it is. If you're doing this through an EAP, it's under 5 minutes. If you're doing a paper app, you can see that too. I would always encourage you, maybe if you're talking to the clients, although you probably can memorize those two questions, and also the additional question about whether or not there's a replacement. Not difficult at all. See, health, value, peace of mind. This is a great, great solution. It should be. You should have this in your portfolio. There's more opportunities than you're going to take advantage of bringing this Home Healthcare Select to your clients. Even if they have existing coverage, it's always great to give them that comfort of letting them know that you're adding some additional coverage, because people want to age in place. There's no doubt. AARP did a survey that said 86% of people want to stay home if their health were to change. So we know that the progression of care may require that they go somewhere else, and this does not have a facility side to it. That's why I indicated to you that maybe you put this in place first, and then you come back in and look for adding some facility coverage with another product like OmniFlex. But boy, I'll tell you, with our back office support team, and here you got Lynn there in the down right-hand side, the magician, I call her. She's got that wand of being able to just wave it and suddenly she appeared. And so with Jeff and John and Mandy and Morgan and Corey and Lynn, and of course, Tom and I, we're all here to help you. We've been doing this for many, many years, and I want to just thank you for the opportunity that you took to come on this webinar. You can see how easy this product is. It's easy to learn, and I think, as I said before, it's easy for your clients to understand. And please take the opportunity. If you're not appointed, reach out to one of the marketers and make sure you are appointed with Manhattan. This is a solution. This is not a nice to have. This is a must have for you. I believe if you're going to be in this competitive marketplace, serving people of all ages whose health is the challenge, you need a wider net, and this Home Healthcare Select is about as wide as you're going to get. So, Lynn, with that, I'll turn it back to you if there was any questions in the chat, and if not, we want to thank everyone for for joining us. I know the holidays are upon us, and it's good that you're taking time, maybe preparing yourself for 2024. And remember, don't forget about that January 4th webinar that Tom's going to do. Tom does a terrific job, and he's going to give you some great insights on a year in review and then talk about what's coming in 2024. That's again January 4th at 2 p.m. Central Time.
In fact, I can share with everyone that visual. I really hope you'll join us. I'm taking a peek at the chat too, Dennis, as we're doing this. As of yet, I don't have any questions. I certainly agree. This is one of those things that is a must. It certainly adds value, even if your clients have other coverage in place. So just to reiterate that, definitely join us January 4th. As much as we've said that 2023 was a banner year, we've seen some incredible changes over the course of the year. Tom will review those, but he'll also let you know about some exciting things we have planned, what's coming in 2024. So reserve your seat now. I know this is blowing up, and I know that seats are going quickly. So definitely we'll be sending out some additional invites over the next week and a half or so. Just watch your email and save your seat. We do have one question from Scott, who asks, are there any short-term products in Minnesota?
No, Scott, there isn't right now, but we are working. We have another product that you may have been on a previous webinar, which is the AFE USA Chubb. Chubb's approved in 28 states, and we've talked to the folks at Chubb about some of the states that may be coming on, similar to Washington, with some form of a tax, and there's been some change in the legislation in Minnesota, so that is on top of our list to take back to Chubb. I cannot promise you that with the extended care Omniflex or the GTL or the Wellaby that we'll have success there, or with the Manhattan Home Health Care Select or even the GTL short-term home health care product. But we may have success at some point, and I'm not saying it's going to happen tomorrow, because there's been some changes where the unique characteristic of the Chubb product has a 7702B. It's a true long-term care tax qualified, where the benefit is received tax-free, and we're going to be, petitioning Chubb to see if we can get Minnesota to open up the doors for that particular product. But I guess that's a long answer to a short question, but the answer is no.
Okay, well, I'm just gonna, I don't see any others coming in, so I just wanted to thank everyone. Dennis, again, it some scheduling issues came up, and Dennis jumped on last minute, willing to give this presentation. So despite the fantastic presentation, he had zero time to prepare. So way to go, Dennis.
No worries. Thanks, Lynn. Thanks everyone for joining us, and happy holidays to everyone. And join us again on, again on that January 4th. And we probably got a couple of things cooking still yet this week. So thanks, Lynn, for arranging everything, and thank you everyone for being on.
Thanks, everyone. Take care.
GoldenCare is always here to serve you with new tools, new products, new ideas, and new innovations, and always the best support in the business to help you succeed. So give us a call at 800-842-7799 and check out our website at www.goldencareagent.com.